And I do want to mention that we had invited George Till, who was looking forward to attending, a representative from Underhill, who serves on the House Healthcare Committee. Unfortunately, he is unable to join us tonight. It's not for any reason other than he was just physically unable to be here.
In the past, when we tried to undertake major healthcare reform, one of the major stumbling blocks is that we would have to raise state funds to cover insurance for people who are currently not covered. So these federal funds make this a lot more likely in terms of realizing the dream. And then lastly, the bill moves us in terms of planning toward a single payer by requiring that the administration come back to the legislature with some plans around how we would integrate all public and private coverage, or as much as possible under a single payer, and in terms of how we would finance that coverage and have it be divorced from employment, unlike the current system.
I've been actually working on this issue for, well, my son was 3 months old when I started, and he's now 22. And this is the first time I really felt incredibly optimistic about our chances of finally getting a publicly financed healthcare system that includes everyone. So we have taken a major step with this legislation towards a true healthcare system. And by that I mean a system that incorporates everyone into it, that it has dedicated financing. Again, it will not be instantly. It has stewardship. Right now we have actually no one in charge, and we can be more like other countries who basically include everyone. They live longer than we do. They have just as much high technology and whatever as we do, but they just get a lot more for their money. And that it's time that we finally do the same thing. We can spend 5% less in total and pay for more health care out of that, enough to cover all the needs of the un- and underinsured. That's what Dr. Shao showed us. This bill will actually help get us there.
I think one also has to recognize that this is a piece of legislation that represents the interest and opinion of thousands of Vermonters, many of whom came to the State House to let us know their thoughts, frankly, on both sides of the issue. And over the next few years, when we fine-tune and answer some of the questions that I'm sure you will be posing to us tonight, and unfortunately, you're going to hear a lot of, we don't know yet. We're going to study that some more. That's a good thing. That's a good thing, because we are not rushing into something when we create a system that is going to cover all of you and your children, I hope, and their children. It's going to work, and it's going to work because we all worked very hard to make sure that that would happen.
So my language is a little more neutral, and I asked to be on the Healthcare Committee because I see it as a business plan going from one place to another. And we are dependent on two things that we cannot control. That is the federal government and the money coming from the feds, which we absolutely need to use, and we can't predict that, and the ability to get waivers from the federal government. So as a kind of someone looking at plans, I could say that this is a really thoughtful, balanced plan to get us from one place to the next.
It's really been my pleasure to be a part of doing something that I think is extraordinarily exciting and has significant potential, not just in terms of the moral and human rights components of the work, but also the opportunity to really create significant economic opportunity in our state, to be able to improve the health of Vermonters, and be able to crack a nut that has taken quite a long time to crack. We have significant opportunity to get better value for these dollars and to actually spend less while providing more. Our system is so fragmented and so complex that nobody's in charge of it. And the Green Mountain Care Board is an opportunity for us to create strategic leadership in our healthcare system to be able to focus on both access, quality, and cost. Now, the board is a 5-member board in both the House and Senate bills. I think there's a responsible process for nominations to the board, and the duties of the board focus on everything from looking at workforce development issues to information technology plans to reviewing and approving the benefits for both the health benefit exchange that we'll talk about at Green Mountain Care. The board also would be responsible for developing the budget for Green Mountain Care. It would be the first time that you have a systemic approach to all the issues of benefits, provider reimbursements, and cost. Green Mountain Care is a publicly financed universal healthcare system. Every Vermont resident would have access to a comprehensive benefit package, and it would be financed through a public broad-based tax. Let's see, what else is there to say about Green Mountain Care? It's wonderful. But my argument would be that it is appropriate for us to go at a reasonable pace because we need to make sure that we get this right. Not only for our own benefit, but because there are actually some people who are watching us to see whether this actually could work or not. And we have a real obligation, not only to Vermonters, but I think to a broader audience, to make sure that when we do this, that it works, and that it works correctly, and that Vermonters trust it. And I think the timeline provides the resource for us to be able to do just that.